Hi there. We understand the diagnosis of cancer is a challenging life event that impacts both the individual and loved ones, which may bring about many questions and uncertainties. Our dedicated team at Tan Tock Seng Hospital is here to help you through this journey and provide you with the care that you need. Made up of healthcare professionals, including doctors, nurses, pharmacists, other allied health professionals, and patient service associates, our multidisciplinary care team will work together to provide care for you. Chemotherapy is one of the treatment options that are sometimes or often used in conjunction or together with surgery and radiotherapy. It involves the use of drugs to target rapidly growing cancer cells. Other types of drug therapies include targeted therapy, hormonal therapy, and immunotherapy. Depending on the type of cancer you have, how far it has spread, and where you are along the treatment process, chemotherapy can be used to shrink or eliminate cancer, prevent further spreading of cancer, relieve symptoms brought about by cancer, such as pain. How chemotherapy is given depends on the type of cancer that you have and the medication required for your treatment. They are most commonly given through the following ways: injection into fatty tissues under your skin, infusion via peripheral veins. Chemotherapy may also be delivered through a central line such as a port or catheter. It will depend on the type of medication, venous access, and the type of surgery a patient undergoes. How often you receive chemotherapy will depend on various factors such as type of cancer, chemotherapy drugs prescribed, and side effects. You may receive chemotherapy daily, weekly, or monthly. Before going for chemotherapy, you may want to make your financial arrangements and insurance claims, childcare or caregiver arrangements, arrangements for household chores, meals, help, etc., work arrangements such as request for a doctor memo to update your employer or HR, request for medical certificate or hospitalization leave from your doctor during consultation, medical coverage, and document needed. You may want to keep a diary to write down your dates of appointments, treatment schedule, important contact numbers, and questions you want to ask your doctors. Before you receive chemotherapy, you will go through a consultation with your doctor. You may have your bloods taken and go through other diagnostic tests such as X-rays or ECG as well. Next, a patient service associate will provide you with financial counseling to give you a sense of estimated bill. You will also be given your chemotherapy appointment dates. That's it, you may go home. Whenever you come to the clinic, you will start by registering yourself first. Your queue number will be called. A nurse will assess you. Preparations will be done and your chemotherapy and any other medications will be given to you. While you are undergoing chemotherapy, a pharmacist will counsel you. This is for a better understanding of any new chemotherapy and medications that you will be given. Once your chemotherapy session ends, you will proceed to collect post-chemotherapy medications, if any, before you head home. Once your queue number is called, the nurse will draw your blood. You may go home after that. You will receive a call one day before or on the morning of the scheduled chemotherapy session for confirmation of chemotherapy attendance and preparation of drugs. Please take note that to reduce waiting time, blood test is done before the scheduled chemotherapy session. If the doctor requests for the patient to wait for blood test results, please take note that the blood test results would take at least 2 hours to be ready. This is how the chemotherapy treatment room looks like, which is where you will be receiving treatment. You may want to bring jacket or shawl and socks to keep yourself warm, small pillow to rest your head, book or tablet, etc. to keep yourself occupied, trolley bag for transporting of your belongings. Arrange for a caregiver to accompany you if possible. Only one caregiver is allowed to accompany you during your chemotherapy session. You may eat food or snacks, example, sandwiches or porridge, and drink water or beverages during your chemotherapy session. Inform the nurses if you need to visit the washroom. Depending on your chemotherapy regime, the chemotherapy session may take at least half a day, including medication waiting time, pre-medications. Request for medical certificate or hospitalization leave from your doctor during consultation. Report any side effects to the chemotherapy nurses. If you're feeling unwell, example down with flu, sore throat or nausea, please inform the staff when they call you for medication preparation or call the clinic during operating hours. Go to A&E if you have signs of an infection such as fever with a temperature 38 degrees Celsius or above, chills and shivering. Avoid taking Panadol to relieve fever. Be aware that taking Panadol may mask fever and hence delay treatment. Check your temperature with a thermometer when you're feeling feverish or having chills. Signs of bleeding such as large amount of blood in urine or stools, black sticky stools, or significant and/or multiple bruising. Diarrhea or increased bowel movement more than 3 times a day, including increased stomach output, especially if it is significantly more than a usual bowel movement or if it is associated with moderate to severe abdominal pain. Vomiting more than 3 to 4 times a day or severe or prolonged loss of appetite that significantly reduces your food and drink intake for more than a day, despite taking your anti-vomiting medication. If you are unable to come for treatment, please inform our staff as soon as possible during operating hours to cancel the preparation of drugs. Chemotherapy can affect you in the following ways: physically, emotionally, mentally, socially, financially. If you or your loved ones need to speak to someone, you can contact our medical social workers at 6357 8222 to arrange for an appointment. Here are some key contact numbers for you to take note of. Thank you for watching this video. We hope that through this video, you have a good orientation and a better understanding and education about chemotherapy and its preparation.